Hi, my name is Abigail, and today I will be doing an informative speech on HIV. So, 1.1 million people in the United States have HIV. Unfortunately, and kind of surprisingly, only 15% of this total are aware that they are infected. The prominence of this disease is pretty surprising, and what's even more shocking is just the lack of information that people have about it. So today I hope to further educate you about how it works in our body and also ways that you can possibly decrease the likelihood of transmission. So what is HIV? It stands for the Human Immunodeficiency Virus. According to HIV.gov, if untreated, it will lead to acquired immunodeficiency syndrome, or what we know as AIDS. The body can't get rid of this virus unlike most other viruses, so once you are infected, it'll be in your body forever. In concise terms, it harms your immune system by targeting white blood cells, and it just hinders their ability to function. In a moment, I will explain in more depth and detail how exactly the mechanisms of this virus work. This virus and disease don't always show prominent symptoms, and sometimes it does go undetected. So HIV restricts the body's immune response, specifically targeting CD4 cells, and those cells function to help the immune system fight infections. The CD4 count can dramatically decrease when someone is infected with AIDS, making that person more likely to get specific diseases or infections. According to avert.org, HIV enters the body via fluids. It will circulate in the bloodstream and eventually attach to T lymphocytes, or what I referred to earlier as CD4 cells. It injects its genetic material and into the cell, which contains an RNA strand. And then reverse transcriptase is an enzyme that will be utilized to build up the DNA strand for HIV. It will insert itself into the host cell, which then activates the viral infection. So HIV comes in 3 different stages. The acute stage is the first one. The individual who has it will show flu-like symptoms such as headache, fever, swelling of lymph nodes is one, as well as muscle pain. Next stage is the chronic, otherwise known as the latent or asymptomatic. It can last up to a few years, or ultimately however long it takes for your CD4 count to dramatically decrease. And when I say that, it would be around 200 cells per millimeter cubed. In a normal individual who doesn't have HIV, you're looking at about 400 to 1600 CD4 cells per millimeter cubed. And so if you are around that 200 mark, you're gonna be close to the AIDS stage of HIV, and that is again indicated by less than 200 of your CD4 cells. The people who have reached this stage are very vulnerable to certain infections and diseases such as toxoplasmosis, tuberculosis, as well as pneumonia. According to avert.org, the normal life expectancy for untreated individuals in this stage is 5 to 10 years. And the fact that they are a lot more vulnerable to certain diseases can also increase, or I guess decrease their lifespan as well. So all this information is kind of a lot, can be kind of daunting or scary considering of the prevalence of this disease. So now I hope to just inform you of some ways that it can be prevented and steps you can take to decrease the likelihood of transmission. So just to give you a background of how it is spread, HIV is transmitted through bodily fluids such as blood, semen, rectal fluids, vaginal fluids, and breast milk is another one. It can only be transmitted when the virus comes in contact with mucous membranes, damaged tissue, or via direct injection like a syringe or needle. One of the most common ways children can get HIV is through mother to child transmission, and this occurs during pregnancy, labor, or delivery. It's called perinatal transmission. You don't see as many cases of this in the US and other high-income countries just because if HIV positive moms-to-be, they'll get certain medications that will prevent baby from getting infected. So whether it's a baby transmission is one, again, syringes and needles are another way it can be transmitted, and other things that deal with mucous membranes. So HIV is a very prevalent disease that doesn't always have obvious symptoms. It has a complex way of attacking human cells, and just like any virus, while there are treatments for this disease and infection, there are a lot more steps that can be taken to prevent the transmission of it. Since it can be transmitted in many harmless ways, it is definitely important to be aware of how to stop it. And I hope that from this speech today, you were informed of a few of those ways to prevent that transmission. Thank you.